Okay, so several of us turned to Keith because he was an inspiration for moving into this field. Have done this a few times. Uh, we always get good reaction from the audience because I think you think you know what's going on out there, and then you see some cases where you just can't believe that this is happening, and these people are still either practicing medicine or doing research or high up in the world. So feel free to take some pictures. Take a look at the time here. There we go. I'm a surgical oncologist, and I'm in molecular and cellular oncology at MD Anderson, but I have a lot of outside positions. SWOG, if you're not aware, is one of the NCI-sponsored clinical trial groups. I'm vice chair there, so I get to look at all the data and clinical trials, and having the trust of your patients in clinical trials is critically important. I'm a deputy editor of JAMA Oncology, and the first thing I look at is to see if I believe this data. I also depend heavily on my statistician colleagues. Keith is not one of the senior people there, but I know he knows, like Yushir, who is an outstanding statistician from Vanderbilt, who I always turn to for help, including early this morning. I'm on 4 clinical trial data monitoring committees, so we want to make sure that data is reported accurately and patients are safe, and the daily emails that I'll show you in just a second. Now, this is not great graphics, but I could not download this to a PDF. This is from yesterday, or the day before, I'm not sure. And I wanted to look at the number of retractions. So if you go to PubMed and you look up, there's a keyword retraction there, as you can see, and you look up on the search on PubMed, I was surprised. I follow this every day. I'm sure Keith does as well. Look at the uptick in retractions that continue to occur. Realize we're only about halfway through 2023. So it's not like people are being better at what they're doing, but the number of retractions actually surprised me. So as I told Keith, you only have to pay attention to the first 5 slides. The rest of the talk is the same as the other 40 that I've given here. But this is a new one, and this is evolving. So this should shock you a little bit. If it shocked me and I'm in the field, it should shock you a little bit as well. In case you drift off to sleep, remember this slide. There is a driving force behind research misconduct, and it's publish or perish. We all feel this. I mean, I look at my CV, my bio sketch, whatever, and it's important to make sure you continuously have publications if you want to get something from your chair or the higher ups or whatever. If you want to be recognized or speak at a national meeting, you have to get your papers done there, especially in getting promotion, the next job, whatever it is. The word impact factor mania should speak for itself. Every once in a while you get a joke from a friend of yours, or think they're a friend of yours, and they say, my H index is higher than yours. I do have a colleague of mine who checks my H index every day to see if it's going up or down, and it's flat right now. It's been a quiet time during the pandemic, but it's all over, right? The pandemic. Oh, never mind. We won't get into that. Sources of info on research misconduct. This is important, and again, feel free to take a picture of this. Retractionwatch.com. Keith and I were just talking about. This is a great daily email, and these are reputable people. I'll talk about that a little bit more. And they put out great stories. So, for instance, I'll show you an example of a Nobel Prize winner who I've collaborated with, who has multiple retractions. You look at some of the big names in cancer biology, and I can really only speak about cancer biology, and you'll see the story behind it. The dean at Stanford in a bit of trouble. Also, Pub here, I'll explain a little bit more about that soon. The Office of Research Integrity, to be honest with you, I don't find it that helpful. They really don't list as much as they should and keep it up to date in a timely manner. For better science, this guy's a bit malignant, but it's kind of funny to read it. He has cartoons in there, and when he really wants to beat up on somebody, he will really go at it. But it's more malignant than retractionwatch.com. And one of my favorites, if you're, like to drink a beer at night and follow Twitter and look for stuff. Elizabeth Bick is a microbiologist who has this photographic memory where she can remember not only figures from the same, earlier in the same paper, but figures from earlier papers and see that these are duplicated or manipulated, and that's amazing. So this is what I recommend while you're relaxing and trying to stay entertained. I want to make sure I can see this. This is just from a couple days ago. This is retractionwatch.com, the email that you'll get in the morning. I was able to create a PDF and cut this out. And you can see some of the issues. There's a lot of talk about COVID. I'll talk about the number of COVID retractions. And this is my friend. And you know, if I just put up selected stuff up there, it wouldn't be right. Greg is a nice person. He is a discoverer of HIF. There are now drugs that target the hypoxia-inducible factor. He has been a co-author on several of my papers. He provided me with reagents. He looked over the manuscript, provided some feedback. But he has had some retractions recently, and he won the Nobel Prize along with Kaylin from up in New England just last year or 2 years ago. So it can happen to anybody. So watch your data. Be careful when you're a PI. Okay, and so for the people who have seen my talk before, those were the new slides. Keith, it's okay if you check your emails and stuff like that. You've seen this before. So this is what I'm going to go through in my talk today, and let's just start moving along so we can stay on time. So you're going to feel, hopefully you're going to feel something today. You may be shocked, angry, embarrassed if you played around with some of this stuff. Hopefully entertained. I don't want you to be discouraged, but in some moments you may feel that way. I hope you're invigorated, and I'll go to a quote later on about CNS, not the central nervous system, but cell nature science. We're going to change CNS. And you may feel all of the above, which means that if you need to take a break and go look at the sunshine or look at beautiful, beautiful rice, go do so. Okay. Everything you need to know about research integrity in one slide. Okay, you got this? Okay, this is online. So you don't need to look at this right now, but the Office of Research Integrity does have a number of resources that help you out. They try to make it entertaining. I will make a statement that you will not bring back to the head of the agency in that I don't think they're tough enough. I think these are great recommendations, but I think there are a lot more people guilty of misconduct who need to be punished and are allowed to just go back out there and continue to play the game, maybe just right on the margin. Okay, and this is new. And it puts the onus on Lancet that if they know that there's something that's not right, and oftentimes there is image manipulation. I'll use this pointer here. Do we have a pointer?
It's right there on the side, up to the left.
There we go. Okay, I'm sorry. Just woke up. There we go. Okay. So there's a lot of image manipulation that goes on, and sometimes, what I would like to see in the literature is more people describing when people are caught manipulating images to actually show all those images. Oftentimes you will see a note from an author or a note from an editor saying that there is a problem here. We have put in a correction, but they don't show the original problem. And I think that's a problem with publishing, is that I want to see what they originally put in there, and then I want to see what the real truth is, or what they say the real truth is. So they don't always have that. So I think journals are responsible, and as soon as I get a paper to review from the editor-in-chief of JAMA Oncology, I look at the figures. I want to see if the figures make sense. If I see any duplications, I want to do that before I read the paper, because my mind is sharper before I read a 21-page paper than after I do so. And this is PubPeer, which is great. This is open to everybody to comment on, or and certainly to read. And you can see that anytime you see the same color boxes, this is the same image, which may be flipped around. So this is what you'll see on Twitter with Elizabeth Bick, or on PubPeer, etc. So I'm giving you the tools to find these issues, but you can read this yourself. And not everything on PubPeer is fraud. Mistakes are made and corrected, and you have to look at this yourself. And I still look at these boxes, and I want to see, so I can recognize it the next time if I know how people are manipulating things. Normally, they just don't cut the paste, they flip it over on the side, they move it to a different part of the box, etc. Okay, that's me. So that's Mike Ray in my lab. This came up on Pub-Peer. We had, you look at the ID2 bands, I'm sorry, the ID1 band, which is really a control. It's not a major issue, but I think Mike never gave me an answer to this when this showed up on Pub-Peer. I said, were you tired? Were you lazy? Did you run out of reagent or whatever it is? And he kind of just chuckled back, and that was it. So this did not change anything in the paper. I mean, the ID1 is consistent. That was a control. We were knocking down ID2, so this wasn't a big deal, but it was a big deal. It's a big deal with somebody who lectures on research integrity to be on Pub-Peer. But this was correctly pointed out. We fixed it. And it's up to the journal to show what was there beforehand and what was there after. And like I said, they don't tend to do that. And go back to Elizabeth Bick. I mean, her photographic memory is incredible, and you can just see this for yourself. And again, how to recognize the duplications and manipulations and things of that stuff. So you get these emails every morning, and if you're not fully awake by the time you read these emails, you are. So, do individual and institutional predictors of misconduct vary by country? And the answer there is yes. I'll let you look through this article, or you can take a picture of the article and read through it yourself. But there are also countries which reward you for publishing in high-impact journals, and therefore they will reward you with cash, and there's incentives to not behave well. And I see some people who are shocked. You shouldn't be shocked. This is the real world. We need to fix this. Okay, so your best resources, Retraction Watch, I've talked about, Pub-Peer, and throw Elizabeth Bick in there as well. And the Office of Research, U.S. Office of Research Integrity is very focused, and they're really not involved in displaying stuff every single day. So these other resources are there for you. So hopefully you caught that. Okay, let's move on to cancer research. We're not doing as great as we think we are. We're doing better. Precision oncology and immunology obviously have made big hits. But this goes back a couple of years, and there hasn't been anything more recent. I was just checking earlier this week that our success rate, taking a trial from drug discovery, moving it into phase 1, and then getting FDA approval of that drug is still pretty low. Usually, I'd say the best estimate is on the order of about 5%. And we need to do better than that. That's not right for our patients. If we enroll them on phase 1 clinical trials or any stage clinical trials, but of course we start in phase 1, we need to give them a chance. And I can tell you, I just came back from my medical school reunion where one of my classmates, one of my roommates, who I lived with for 2 years, has metastatic cancer, and I'm looking for the right trials for him, and we need to give him a chance. And he's a surgeon, but I'm in the field of oncology, so I'm searching for him, but he has to do his job and get his tumor sequenced, which sounds very easy, but to have another needle stuck in you to get a core biopsy to do sequencing is not the easiest thing. So put yourself in the patient's position sometimes and realize it's just not like walking into Walgreens and getting a core biopsy in NGS. Now, this was covered. These are called magazines. And this is covered U.S. News and World Report and Time Magazine years ago. And we're done. We've cured cancer. And lots of other journals came out similarly, but these were the lay journals that came out. But something happened. This wasn't real. And other people put out similar publications where they absolutely cured cancer. And I'm not being biased at all. Harvard is great. Hopkins is great. Houston is great. It's 3 H's, I guess. This happens, everywhere, but it does happen in places where they tend to publicize their work a great deal. So I'll go back to Bob. I just saw him a couple weeks ago at the ACR meeting. This is a picture from 2000. He looks exactly the same, I'm happy to say. When I emailed Bob, because we were trying to reproduce a whole bunch of stuff that was published as the foundation for moving on to a grant to the next step, Bob informed me that Glenn Begley, who was head of drug development or the cancer biology at Amgen at the time, had prospectively collected data, and that he was only able to, his group, meticulously trying to reproduce studies, was only able to reproduce studies 11% of the time. Okay, let that sink in. Sitting at breakfast with people, going over their methods, where do they buy this reagent from, everything, 11% of the time. And it's not an isolated event. This, again, is the work from Glenn's group and colleagues who trained in cancer biology at MD Anderson in addition to Bob. But other groups have also had difficulty, and this is an old slide now, but just to show that other groups, even in other areas of research, have had trouble reproducing. Here's a great one, is 0% reproduced. That doesn't mean that they couldn't have made a mistake, the investigators here, but just to make the point that this is not uncommon. This wasn't just Amgen, this is Bayer, this is big companies, big organizations. Just to put this in graphical form in a number of different studies, you can look at the number of studies that people tried to reproduce here. This is ours, and this is the irreproducibility rate, if that's a word, or I just made it a word. Not very good, even at 50%. The ability to reproduce something that's in CNS, cell nature and science, or your CNS, that's okay too, is 50% at best. Not great. And this costs money. So the irreproducible research costs people, this goes back to about 2015, so it's a little late. I couldn't find anything more recent on this, but $28 billion. How do you think the NIH feels about that and funding the studies that you hope get funded so you can continue on your career? And then this created kind of a crisis. Our paper came out in 2012, and others, soon followed. And Nature put out a survey, and is there a reproducibility crisis? And you can see here, you learn how to read all kinds of lots these days in papers, and this is a relatively simple one. Most people think there's a reproducibility crisis, and to various degrees, but it got people thinking. Now, it hit its peak right after we published our paper, and a few other people put out the paper, and then Keith will talk about some issues that he has had to deal with as an outstanding statistician and biologist. But this is real, and it continues to go on. So let me see what we're talking about here. This comes from my beloved University of Virginia, where I went to medical school and just came back from my, I hate to say this, but my 40th year med school reunion. I talked about my old roommate with cancer there. 40 years, how does that happen? This is and UVA has an honor code, so this is a great place to do this work. And one reason I love UVA, I have my family there as well, but also it's the honor code. And Brian Nosek and Elizabeth Irons, who's not at UVA, but she was part of this group, and Tim Arrington tried to reproduce studies going meticulously through the methods and all that, all the information, contacting authors about where they got reagents from, whatever it is, and they were only able to reproduce about 26%. So this is fairly consistent. From our study, from Glenn's study, where it's about 11%, up to larger studies where it's 50%. Still, the majority of studies, or at least half or more studies, cannot be reproduced. Are you all depressed? Okay, deep breath there. So what are the consequences of all this? Well, I think there's a spectrum. There are people who make mistakes. There are people who have bad reagents. There are people who are a little bit sloppy. There are people who don't consult statisticians because they have a computer program and why do they need to consult statisticians? And I'm being cynical when I say that. That's not the right thing to do. But the consequences infect our patients, and hopefully not yourself or your family members, because this is tragic. But most of our clinical trials are bound to fail if we put up data that is not reproducible and based on good biology. Loss of time and effort, waste of money, and the loss of confidence from our community. So who's going to put $50 million into cancer research if we know that only about 25% of cancer research can be reproduced in the lab, and then that doesn't translate to the clinic? I think most of this is just sloppy or selective reporting. I think this, hopefully, in my mind, is the outlier. Honest reporting does occur from time to time, but most of it is like I said, cell line contamination, not doing inappropriate stats because you have a computer that can do that for you. And then we have AI, which I'm not going to go into. Keith may comment on that, but I'm a little bit, sometimes good common sense plays a role in data interpretation as well as plugging something into a computer. So AI may be a topic for the next time, Suzanne, that we do this. I'll leave that to you. There is also a problem with the system. Journals prioritize positive results, and we need to put out negative results. If we did studies the right way in the laboratory, and certainly in the clinic, we owe this to our patients, we need to make sure that we publish these results. So if you do a study and you're looking at the effect of a CDK inhibitor in colon cancer, and you study this in 4 cell lines, whatever it is, and then xenografts, you need to report in the paper that in 2 of the cell lines it didn't work. And maybe we can figure out if there's some bypass pathway or RAS or whatever is going on. And that's what we're doing right now in colon cancer, is we're realizing that those patients who have tumors that have a RAS mutation or certain BRAF mutation or whatever it may be will not respond to targeted therapies. We actually proposed this in a review article in 2005, just trying to use good common sense and not just keep pumping out data. We also have the problem of publish or perish. I will state that this comes from somewhere in the Northeast with a name that begins with an H, where you have 2 trainees working on the same project, and the trainee who comes out with positive data stays, and the trainee who comes out with the negative data or doesn't have positive data doesn't stay, and that still happens. Some of my friends have moved up there. So I'll briefly go through this. You can read this yourself. We have to, people have talked about this for a while. This goes back to, midway in the reproducibility crisis. We need to highlight negative results, and I think it's hard to get a paper published if you're just saying I did studies and these were negative. I think you have to, when you have a positive study, that will get published, but you also have to put in your positive study the studies that did not work and perhaps hypothesize why, as I talked about, could be an underlying driver mutation that is not affected by the drug or whatever it may be. And forgive me, I know this is a mixed group. All of my work is in the world of cancer, so I want to, mostly my comments will be focused on cancer. But let's talk about misconduct, because it's not just selective reporting, it's also misconduct. Do investigators intentionally falsify or fabricate data? So after we published our paper, I got this email, and you can read this yourself. I'll highlight the bottom part, that the PI wanted to produce falsified data, I refused to do so. Many PIs fired me as soon as they realized that I don't do wrong things. They sabotaged this person's professional life. This was a real email. I didn't make this up. I don't falsify my products or my data. So I think I'd like to hear a few groans when you read this, because this is real. Somebody groaned. Okay, never mind. Thank you. Yeah, this is really a problem. And I'm not going to go into this because Keith gives an incredible talk on this situation, and he and his colleague broke this open. And Dr. Potty, who has been found, this is retraction watch stuff here, but Dr. Potty is still a practicing physician, even though his ethics may not be what you would want if you were taking a loved one in for cancer care. But Keith will wow you with this. And there are other fraudulent papers out there, breast cancer and bone marrow transplants. This was never published. The ASCO meeting is coming up in 2 weeks, American Society of Clinical Oncology. Autism and vaccines, I'll talk about in just a second, and tracheal implants more recently by Mackie Arena from the Karolinska Institute and his team institute that I had visited, and all made up data, sadly. And this goes back to vaccines. You can read this quicker than I can read it to you, but I'll go to the highlighted bullet that even before the publication was of a study saying that vaccines can cause autism, and you can see this has had an effect on our recent history here in the world, that Wakefield was actually patenting his own version of the measles vaccine. Now, is there a conflict of interest here? I'm not a business person, but I kind of think there is in the COI here. And I did pull this 2 days ago. Today's 17th or 16th? 17th. Okay, so this isn't really that old. But this shows you the Retraction Watch leaderboard, which I love the fact that my colleague Zyber Naransky and his team will continue to post this and update this every year, and there are a lot of retractions. I know it's hard to see, but this just gives you an idea of the retractions, which probably aren't enough, as I've described. After all this occurred, Len Rowan came up with the idea of doing a survey. This all came from colleagues in cancer biology. Suzanne left the institute and moved to another, I think she moved to South Carolina. But when we sent out this survey, what was interesting is that within 6 hours of getting an email at MD Anderson, 240 people filled out a survey. That's a lot. You know, people are busy doing work, they're busy doing anything. And we had 311 responses, and again, I give Glenn credit for pushing this through. And have you ever tried to reproduce a finding from a published paper and not been able to do so? And you can see for yourself, you know, nearly half the time, or half the people who responded have had this issue. And you know, for senior faculty, they may be so old like me that they forgot what they were doing early on in their career and weren't focused on this. But you know, half the people have had trouble reproducing results, and I suspect that it's probably a little higher than that. But this is the data, and that's what we have to go on. Were you ever pressured to publish findings? 22%, of which you had doubt. That's important. Have you ever known pressure from a mentor to publish his or her hypothesis, to prove that his or her hypothesis was correct, even though you generated data that did not support the hypothesis? A third. I hope this shocks you. It still shocks me. Are you aware of mentors who require a CNS paper before a trainee can leave the lab? Half. Okay, lots of silence there. I don't know if that's depression or you're bored, but it's lots of silence. And then again, going to selected comments, I'm not going to read this whole slide, but we want to focus on international trainees, also visa issues, and things that I didn't think about when I was going into this field, and that the PIs start to push them with visa issue trainees, the visa issue trainees, and that's what came in an email, feel a lot of stress and eventually give the PI the data that they want. So it's being able to stay in the country and stay in an institute or whatever it is. So, all right, everybody take a deep breath. I'm feeling that I've impressed everyone. Okay, then we followed this up with another survey. Delphine was in my lab, and there's a guy, Baggerly, I haven't seen him in a while. And we had 467 participants in the Texas Medical Center. And most were postdocs, a few students. And to get to the highlights of this take-home points, half of the investigators, less than half of investigators verify cell lines at least every year. In my laboratory, we do it every 6 months. I actually encourage them to do it every quarter. We have a cell line identification core. We should be doing this. Just over half test for mycoplasma yearly. Less than 20% of investigators perform blinded studies as a routine. That's a statistical issue. It's good to be blinded. And less than 50% consult with a statistician, which is mind-boggling to me because having taught multiple clinical trial writing courses and worked with great statisticians, especially with big data these days, you have to have a statistician on your team. For any of us that think that you have a stats program and that's all you need, you can just keep hitting a different test until you get a p-value less than 0.05. And I'm not being cynical, that's done quite a bit. You need to learn from a statistician. You need to be part of the team, understand your hypothesis, understand what you did, understand how many times you did it, and make them a part of the team and just don't shove the data their way. Research integrity and reporting transparency. It's a little hard for me to slide up here. I think I get older every year that I'm up here, but I'm not sure about that. You feel it's necessary to have a first authored paper in CNS to get an academic position, more than half. Do you feel a pressure to publish or perish? Yes. Have you ever fabricated or falsified data? No, but you've seen somebody else do this. And have you ever witnessed someone doing it? That's about 25 to 30%. So it's out there. I mean, people know that people massage data, falsify data, choose the best data. We all know that. So for 35% of participants, the revision process was greater than 12 months for a high impact journal. And my highest impact basic science publication was in Cancer Cell. It was torture. It was unbelievable the amount of times that it kept coming back, and the amount of money that we spent you could never put into a grant application. You post these experiments, and if it happens to go through a first pass at Cancer Cell, please factor in another $600,000 because that's what it's going to take for the revision, and I'm not being cynical about that. The cost of a revision was $25K and greater than 40% of cases and greater than $100K and 10% of the cases on a revision. I think that this is actually old data right now. And 25% of those surveyed, the manuscript did not increase significantly after revision, but you're at the mercy of the reviewers, and they're asking you for you to respond in a positive way, and you have to respond in a positive way. Okay, why does all this occur? And the causes of massaging of data. We've talked about this. You look at the trainees, they need to move on, they need to get out of the lab, they need to get their next job, they need to stay in the country. Visa issues. For faculty, it's the same thing. We need to get promoted. We have yearly reviews. We need to get recognized so we can be speakers at international or national conferences and be recognized by our peers. We need to get on the NIH study section to really beat your fists on your chest and get credit from those above you. And I'm not being cynical about this. These are all good things to have. Good publications that impact the field, that perhaps impact the lives of patients somewhere down the line, and you get rewarded for that. Those are good things. But sometimes your data doesn't come out as robust as you would like it to be, but you still need to report it. So you shouldn't just put the data out there that people want to see. You should put the data out there that's real. And this was a Nature survey. You can read this yourself. I kind of highlighted the right side of this. Which factors contribute to irreproducible research, and I would always say that selective reporting, you do all these experiments and you pull out the best studies that you have, and that's what's going to get into, it doesn't just have to be Nature, it can be cancer research, clinical cancer research, JAMA Oncology, it's mostly clinical research, so, but I would say the same thing. People would shove the other data under the carpet. They wouldn't even put it in a appendix, which is allowed in many of these papers, and a lot of reviewers are not going to go back and read the appendix because everybody is short on time. But you can see the reasons here why data could be irreproducible. So let's talk about high impact publications and impact factor media. And this is a quote from a postdoc, in the cancer biology department. As I was walking down the hallway, I saw the interaction, and then I later heard what was said by the PI to the trainee, is that you are nothing unless you publish in CNS. Wow, that's a lot of pressure. And I don't think CNS was for clinical cancer research. I think that was like the cell journals and stuff like that. So that's the teaching that we're doing right now. We need to rethink the way we teach. So I've met some friends during this journey. Arturo Casadevall is now at Hopkins, Barrett Fang is in Seattle, and just summarizing this MBio paper, again, microbiology, that the causes of impact factor mania are associated with value of the work of the journal where the work is published rather than the actual work itself. This is causing profound distortions in the way science is done that are deleterious to the overall scientific enterprise. And then there's the question, should we eliminate the impact factor? And I don't think any high impact journal is going to agree to that. And publishers have both high and low impact journals, so you can eliminate the impact factor for anything less than 10. But for anything that's higher than that, let's keep it because that's, my journal has a very high impact factor. Talk to Sel about that one. What's interesting and what's kind of intuitive is that the higher the impact factor in the journal, the higher the retraction index. And this is again work from my friends in the microbiology field. And it's not a perfect line, but it's a pretty good line. As you read through, now everything is online, and you're not picking up journals anymore. But at the beginning of once you click on the table of contents, whatever it is, see if there are any comments about retractions that have occurred. Typically, they're at the very bottom of the page as you scroll down. They're not going to be at the top, but that's where you're going to find the retractions. And then a Nobel Prize winner who's already won the Nobel Prize declares a boycott of top science journals, and I always kind of make a joke about this. Well, what if you have really great data that should be in Cell, Nature, or Science? I mean, is it fair for you not to submit to those journals? So once you've won the Nobel Prize, you don't really care about stuff like that anymore, but you really should. And because it's the people that you're taking care of that count. Okay, final comment on impact factor mania. And I truly believe this. Strive for nature. There's nothing wrong with shooting high. You have great research, and you can say, okay, if we're going to get this in the Nature, we're going to have to do these confirmatory studies, increase the number of cell lines, etc. But don't die or lie to get into Nature. The truth, there are patients at the end of all this. There are real people at the end of all this. And we need to be honest. Okay, what can we do to fix this? We need to be kinder as reviewers. As an editor of JAMA Oncology, I see some really nasty comments that I will cut out. And it's one thing to say that the statistical analysis wasn't great. It's another thing to say that these people have no freaking clue what they're doing in their statistical analysis. And I do edit comments before they go back to authors. And when somebody is really nasty, I put a note next to their name as a reviewer. Now, reviewers don't get paid. They're doing this as part of the system, out of the goodness of their time and heart and effort and being part of the system. But at the same time, you need to do a good job as a reviewer because that's what you want for your journals. We should not torture the trainees to the point where they massage the data in order to satisfy the PI. PIs need to implement best research practices, get their cell lines checked, have a weekly lab meeting, and now with Zoom, and I know I don't have stock in Zoom, or WebEx or whatever it may be, is that even if you're out of town, you can have a lab meeting. And I was just traveling back from the SWOG, the clinical trial group meeting in San Francisco, and had to skip our lab meeting, but we just had a lab meeting yesterday, which was great. And you can do this quickly and stay up to date weekly, no matter where you are in the world, and not just get an update every 3 to 6 months or when a paper is ready to be submitted to a CNS journal. And I update this every time I come in. This is from the Office of Research Integrity. The number of people who have been found guilty of research misconduct, I think this list is woefully short. I can tell you there are enough people that I have met one-on-one or talked to their postdocs where there's much more research misconduct than this, but they find very few cases. In 2021, I was so disappointed. I wanted to see more people punished. 2022, it went up a little bit. There's only 2 cases so far as of 2 days ago. Now that I know what date this is, so if we got to have some punishment for misconduct if we're going to give pats on the back for great papers. So and there was a case in the TMC. I'm not going to go into details on that. So one of the problems is that the investigation into research misconduct occurs within your institute, not from an outside unbiased group. And does any full professor who leads this, and there are good people out there who will do what's right all the time, And then there are people who will not do what's right all the time. Do you want to put a stain on your institute by finding somebody guilty of misconduct? I actually think that misconduct investigation should be done by an outside group of people who don't have anything at stake here. So, and there really isn't a deterrent, even if you're found guilty of misconduct. It's kind of a slap on the wrist. And I think if all of us knew that there were major problems with research misconduct, that would end your career, that we would behave a little differently if we had more thorough investigations from an outside source and collecting your lab notebooks, which are now required, and all that kind of stuff. So I don't think we're tough enough on people who are guilty of research misconduct. And there's an inherent conflict of interest that I allude to, and I want to try to finish up quickly here, is that your own institute does the investigation. Now, it would cost money to bring people in from across the street, and across the street they may be your competitors and so forth, but I think there has to be a better way of investigating potential research misconduct. And once a decision is made, then it goes up from the research integrity officer to the provost to the vice president or whatever it is of the hospital, and it's all done internally. And there has to be a better way to do this. And I will end with my superhero, John Lennon, and this Einstein guy is not bad either. A couple quotes here. I'm sick and tired of reading lines by seasick, narrow-minded, short-sighted hypocritics. That's why I love Lennon. All I want is the truth, just give me some truth. And I think he was speaking to us when he said this in a song. And Albert Einstein, pretty good thinker too. This is outside the National Academy of Sciences. The right to search for truth implies also a duty. One must not conceal any part of what has been recognized to be true. And that's amazing because this quote is from a long time ago. And to have this foresight that, he would know that I would read this in my talk. I really thank the person for this. And the quote up on top is from a colleague of mine who read through the paper and saw a presentation. It was very nice in reading these comments.
Thank you, that was a fantastic talk. I think we talked a lot about CNS, but I was wondering if I could get your thoughts on, I think, what we consider or categorize as predatory journals as well, and the other side of the spectrum. I think, because I think a lot of us associate predatory journals or what people call predatory journals as like less rigorous and less, or I guess where those kind of fraud might be happening more often, so we kind of obviously want to stay away from that. But I think what I found really astonishing recently is that even journals that have been established in the field for decades are now recently starting to be labeled as predatory journals. And then I don't know if that's because they're trying to stay relevant in the modern age and some things about the internet, or I don't know. But I just wanted to know your thoughts on those kind of journals.
Yeah, I haven't seen a lot of that terminology in my readings every day. And like I said, you get the retractionwatch.com and the other things. I think that this is a business. Cell, nature, and science are competing against one another. I mean, there's no doubt. The AACR, the wonderful organization, wonderful leader, Marge Fody, and I know the staff there very, very well over many years. They want the honest truth, but they were competing with themselves with their own journals and stuff like that. So this is also a business, and that adds to the confusion, the complexity, getting the high impact publications. As you go to the AACR, and you're not all cancer folks, I understand that, but the American Association for Cancer Research or ASCO, American Society of Clinical Oncology, in a couple of weeks, these exhibits from the either organizations or the companies like Nature themselves are huge. And this is a business. They want the best, and they get their advertising through that, and they get those subscriptions through that, and it's hard to separate the two. Now, it has to be a business. You have to support this somehow. I would, hope it's a nonprofit, but I think everybody wants a little profit, so when the tough times come and there's money there. But the bottom line is it's a business. So, every time you read an article, you take it with a grain of salt until you see the consistencies. Now I know you're going to look for image manipulation. You're going to look and see, you can go online and see if they're in the Retraction Watch database, or if there are comments on prior papers on PubPeer, and if you want to see if something is true or if somebody is always being questioned for something. So I'll do that from time to time if I see something that's not right, because there are these great big databases. So PubPeer, and oftentimes on the website, when you pull up a link to an article, at the top it will have a little at the top a byline saying that there are 2 comments on this paper on PubPeer. So there's an easy way to link to it.
Thank you so much, Dr. Ellis. I have a question about whether or not it's possible, what your thoughts are on how we can incentivize the publishing of negative data as well. Because I think PIs are also a product of this system wherein the pressure to publish is so immense. And I'm wondering whether, I know that there are journals, but it hasn't really picked up steam in the way that CNS has. Do you think that there is a role for CNS and journals of that caliber to start publishing negative data as well?
Yeah, what I think doesn't matter, I don't say that in a cynical way. I mean, for CNS, a good question. For CNS, are they going to have an online only? This was a negative data. I do think that periodically you will see either negative data within a study which also has positive data, or a really well done negative study. Now, going back to the finances of this all, those studies need to be short, they need to be open access. The open access needs to be paid for by the authors of the study. So again, this is a business. Now, to us, this is a patient with cancer or cardiac disease or whatever it may be, and we're trying to help them. To the journals, this is a business, and there's nothing I can do about it. So paying the fees for open access is going to be the best way. And in JAMA Network, you pay to have a publication fees, but you go to JAMA Network Open, and you may pay a little bit more, but it's open access to everybody in the world, and you don't have to have a subscription through your institute. So when you're publishing negative data, it's another disincentive. You need to pay the publication cost yourself, because it's going to have to be like in an open access journal. It's a really good question. It's something that we need to address more.
I have another question. Thank you for the talk. I was wondering from a graduate student's perspective and aspiring postdoc, like what are the things that we should be aware of or consider or practice being a grad student or a postdoc, because most of the time we're at the mercy of the PIs, so things that we can practice and be aware of.
So I think, hopefully after this talk, I think you look at every figure and you try to figure out if this makes sense. Number one, is this too good to be true? If you see in the, and you have to open up the appendix a lot of times, because that's where a lot of the cut and pasting and the copying and pasting occurs. So I think hopefully this just opens your eyes. I don't want you to leave here depressed. I want you to leave here more aware. But again, wake up in the morning, get these emails, do a quick run through it. They may not always be in your area of research. I think this is a mixed group. It's not just cancer biologists here. But always, a lot of people will not go to the appendix and look at stuff. And the other thing is you can type their name into a database, whether it's retractionwatch.com or PubPeer, whatever it is, and see if they have a history of doing this. And I can tell you this, there are some of my peers, I'm doing my best to keep quiet, but some of my peers at MD Anderson populate a lot of space in PubPeer. 200 and some comments for some papers. Oh, I'm dying to tell you who it is. Okay.
So, as a deputy editor working for a big journal and also like someone who works with the publishing house organizing for journals, do you think you have a voice in terms of getting systems in place, say using AI for image, for detecting manipulation in images, just automating PubPeer queries against the authors of a paper that come in? Do you feel that you are able to do that working with a publisher, and are publishers feeling the heat in terms of reproducibility, that it is their responsibility?
This area of research integrity and publications reached a peak probably, Keith, how long ago would you say, anywhere 5 to 8 years ago or something like that?
2012 to 2014.
Okay, yeah, so we're in that range, somewhere there. And I think it's reached a peak, and I think people have noted it, and then they're moving on. And that's why I like giving this talk, because I want to bring this to your attention. I'd like to, after we published this paper, I was giving talks at AUCR, at ASCO, at the workshops for clinical trials, and not asked to give these talks anymore. Fortunately, Suzanne and the team, I think this is integral to your education and your careers and things of that sort. But as far as the rest of the world, it hit its peak and it's come back down again. You need to go, rewind 60 minutes, and which you will see in just a couple of minutes, and remind people that this is important. People's lives are at stake.
I have a question about, so in the light of the pandemic, several publications, it became kind of trendy to publish as a unrefereed preprint. And I'm, first of all, asking whether those same things, like things that are unrefereed, do they also land on PubPeer or Traction Watch as frequently? And then just any general comments you have about that, and whether there's a feature in that, if that's getting too popular, or
I can't answer that because I don't have enough time in the day to go back and read that. I'm not saying that as a joke. I mean, it's hard enough to go through all the cancer journals and do my job at John Oncology, so I honestly can't answer that. I have not seen on PubPeer, when I do get a chance to scan through it, them comment on preprint papers. I mean, the whole idea of putting out a preprint is to get comments ahead of time. So I have not seen that, but I really can't fully answer that question because I haven't looked into it. Sometimes you have to be honest and say, I don't know. I don't know.
Hi, that was a wonderfully depressing talk, so thank you for that. But my question is more about what are the institutions doing at a higher level to sort of tackle this? Is there any sort of movement to, address these sort of issues?
No.
And why is that? Why is there no push from the higher
Because
ups?
they didn't show up to my lecture this morning. I mean, the people are, like I said, it's a stain on the institution. And if you have somebody who is, I can think of a friend of mine, but he or she is very guilty of putting pressure on the lab, and he or she is the one who said you're nothing unless you publish in CNS. And, who are the people who are going to get promoted and become department chairs? So the upper levels are aware of all this, but unless you have the absolute, and sometimes it's hard to have 100% assurance that this is complete fraud. But sometimes when you have 267 comments on PubPeer, and you can look at the figures and you can see the image manipulation. I mean, as soon as mine was identified, I addressed it that day. I mean, Mike Gray hasn't been in my lab for 12 years or whatever it is, but I got in contact with him. I got a chuckle back from him. I got a little excuse back from him, but not much. But that had no real impact on the outcome of the paper. For those, CNS papers, I don't think there's really a way to get the president of the institute or the CEO of an institute is trying to keep finances coming in, trying to keep people coming to work during this crazy time in the history of our world. And I think this is a lower priority now than it was before. And I'm just saying that out of reality. I mean, try to get a doctor's appointment in the medical center right now. For a routine screening of something, it's 3 months before you get your visit just to say hello. So I don't think the head of institutes are really interested in that. I'm not saying they're bad people. I'd say they have a higher priority, providing timely care to the patients